Hello, and as always, thank you for watching us here at Palos Heights Community Channel 4. My name is Carol Steffen, on camera with Judy Weber. We've been invited in to talk with Dr. Jacob Mathalem, who is a doctor of physical therapy. We've been in to visit him several times before, at least one time before that I remember, and we got such a positive response from the community that watched the show that we thought it'd be a good thing to come back and talk with him again. Let me give you some particulars before we get into the conversation. The name of the name of the business, Pro-Rehab Services, located at 6400 College Drive. It's a physical therapy and rehab center. Suite 800, the number is 708-489-6777. That's the Palos Heights location. There's a secondary location out in Tinley Park, and that's 9518 West of 179th Street in Tinley. 708-633-0600, and we'll have these numbers running across the lower part of the tape. Thank you for inviting us in.
Well, Carol, thank you for having us.
He is Dr. Jacob, but I'm going to call him Jacob because I've been a patient of his for a very, very long time, and I can't recommend him enough. But anyway, who is your typical patient?
Our typical patient is we primarily catered to adult orthopedic-based patient base. We also cater to or treat young adults and high school age children, our young patients. But primarily we are orthopedic based practice.
Okay. Explain the difference between orthopedic and chiropractic.
Well, the orthopedic physical therapy primarily deals with musculoskeletal injuries, including but not limited to post-operative care, such as joint replacement, spinal surgeries, or fracture care. So we see these patients after their surgery. We see patients for back and neck problems, both conservative management as well as those who had undergone spinal surgeries. So that's primarily the physical therapy aspect of it. Chiropractic, on the other hand, they also include physical therapy in their treatments, but they also, the main focus of chiropractic is also manipulation of the spine.
Okay. If I needed to see you, Jacob, or a friend of mine, what's the first thing? Can they just walk in the door to make an appointment, or what's the process?
Well, physical therapy in Illinois most recently passed a direct access, but it has not been signed into law yet. It was just recently passed. Physical therapists can evaluate a patient and create a plan of care, a treatment plan, and that needs to be approved by a physician who is licensed in Illinois. Now that can be an MD, your primary care physician who's an MD or DO, a nurse practitioner, or a dentist, and in fact, or a surgeon for that matter. Yeah. So the referral can be initiated by the physician, referring to the therapist, the patient for evaluation and treatment. But the plan of care has to be approved by the physician, and that's how it works.
Have you seen a greater need for this process? I see so many of these places popping up around, and I think that I know there's so many more adults into athletics as they retired. The young children are playing the soccer, they're playing all sorts of athletics from young age all to great old age. So I'm sorry, go ahead.
That's a very good question, Carol. The scope of physical therapy over the years have expanded. People are living longer with better quality of life. People are very active. Along with that comes the greater awareness and the need for our physical therapy services. So we are also, our population is aging. So in that respect, we see a lot of patients going through elective surgeries, joint replacements, for example. And so there is a greater need for physical therapy services in the community. The younger patients, the school-age children, they are into athletics, sports-related injuries, and then another aspect would be work-related injuries. So the physical therapy plays a big role in injury prevention, and when injury does happen, then aftercare following any kind of surgery or maybe it could be conservative management as well.
I know at one time it was a surprise to me when I had some surgery and was recommended in the hospital that it would have benefited me more to have exercise, physical therapy before the surgery to strengthen the muscles. Do you want to address that?
Sure. The preoperative aspect of physical therapy, we do see some patients for preoperative care. So when you are diagnosed with, let's say, an elective procedure, the doctor may choose to have you come in for some preoperative training and some strength training prior to going into surgery, and that could affect the postoperative outcome. But not everybody who goes for surgery goes through preoperative care. Many reasons for that. Number one, it could be that patients are in so much pain that prior to surgery that they cannot tolerate any exercises. Number two could be financial. You may be limited by going to physical therapy preoperatively due to insurance regulations. You have limited visits allowed by the insurance, so you don't want to use it all up prior to surgery. Then after surgery, you cannot use it. So
tell me about the insurance. The insurance covers physical therapy?
Yes, insurance does cover. Most insurance plans cover therapy, especially when it is ordered by the physician and it's based on medical necessity. Now, not all plans will cover physical therapy unlimited. There could be stipulation as to a certain amount of visits allowed per year by the private insurances. They could be based on medical necessity. Some plans do not have a limit. It is based on medical necessity. Patients who are Medicare aged, there used to be a therapy cap in place annually with an exception process in place. In other words, if the therapist feels and the patient feels and the doctor feels that the additional physical therapy is warranted, there's a process that we used to go. We are trying to get that repealed. Hopefully that will happen, but in other words, care is not denied if there is a medical need. But private insurances, on the other hand, they do have their own mandated limits, and we have to work within that limits.
What if the patient isn't able to come in, Jacob? Do you do home care at all?
Yes, we do. That is something unique to us. Not all physical therapy clinics have home health care services. Our sister agency, Choice Care Home Health, which has been in business since 2001, is a Medicare certified, state licensed home health care agency providing not only physical therapy but also skilled nursing care, home health aid services, speech therapy, occupational therapy for those patients who are homebound.
Okay.
So once you get discharged from the hospital, if you're considered homebound and the doctor feels that the skilled services are needed, then we do provide those services in the patient's house until they are able to go for outpatient therapy.
I know we've taken a look at your establishment here and saw the rooms. There's private treatment rooms. There's all sorts of equipment to work on. There's a table to be massaged and exercises. Yeah. There's a set of stairs to work on for varied needs. But there's an upstairs. What goes on upstairs?
Upstairs we have treatment rooms for pediatric patients. So we have pediatric speech pathologist who sees pediatric patients for speech therapy on a one-on-one basis. That is strictly for adults, for pediatric patients.
That's it, okay. I'm trying to think what else I was going to ask you about. There's so many things. I had noticed last time I was in here, there's so many seniors that are in here. And I've noticed the problem, and I can notice myself as I grow older, is balance. Just addressing the lack of balance and what we can do about it.
Well, we get several referrals from doctors specifically with that diagnosis, balance issues, gait dysfunction. And as our population ages, there is certain amount of weakness in the muscles that goes along, which in turn leads to gait and imbalance. Patients who are diabetics or non-diabetics can get neuropathy. So we work on strength building and working on their dynamic and static balance to help them get with the proper adaptive equipments if that's needed. Hopefully get them to a level where they don't need that assistive device, and teaching them. Basically that really revolves around teaching the patient to be in a safe environment. So prevention is always better than cure. So we how to prevent a fall so that they're not dealing with hip surgeries. To that extent, something unique that we started with, we started what's called a prep club. What that is we call it prep club stands for post-rehab exercise program. Those are for offered to our patients after they are done with the skilled services. They are allowed to come back to the clinic while the clinic is open, under the supervision of other therapists, under the guidance of the therapist. They exercise on their own. They have a program that is designed for them. They follow through with it, and we do not bill insurance for that. It's not a skilled one-on-one care, but under our guidance, and many of our patients take advantage of that.
Yeah.
And there is no contract. You stop when you want. You come when you want. You can come on 5 days a week, 3 days a week, until you feel that you are capable of carrying on your home program on your own.
That's really a good facet.
Absolutely. It's very well received by our patients. We offer that to all our patients, and the cost is very minimal. It's only $40 a month, and there's no contract to sign, but you just have to call and make sure that we are here. The facility is open. We are open Monday through Friday, 8 a.m. to 6 p.m. Weekends we are closed.
Okay.
But they can come and utilize any of the equipments, and if they need help with setup of those, we will set that up for them, and we will correct them if they are not doing it correctly. So
how long has that been in existence, Jacob?
We started that program about 6 or 7 years ago,
Okay.
and it's offered to our current patients who are discharged, and they can come and really benefit from it.
I know that you have a doctorate in physical therapy. Tell me about the rest of your staff.
At this location, we have 2 other therapists, one other therapist and an assistant. Joni Diastis is a physical therapist, licensed physical therapist with over 20 years of experience. She works here Monday, Wednesday, Fridays, or as need there be. And Brian is my PT assistant with over 12 years of clinical experience, and he is full time. And between Brian and myself, we cover both Tinley and Palos location. Joni is here, and then we have our front office staff who's been with us since we started 20 years ago. It's hard to believe we've been in Palos Heights for 20 years, and very proud to have and to be here, and the community has supported us, and I thank each and every member of our community for supporting us and receiving us. So Sandy and April have been with us, and we do our in-house billing, scheduling. And on the pediatric side, we have 2 excellent pediatric therapists, speech pathologists. They are certified, and they work in the school system, and they come here and see our pediatric patients. And they have been with us again since we started 20 years ago.
Wow, you're doing something right to be
I hope
lasting
so.
that length of time.
Carol, we take pride in what we offer here. I don't believe, or none of us, the clinicians, we believe in hands-on therapy. We provide lots of hands-on care and attention to the details. And the other thing that we emphasize is, when a patient gets started with the therapist, you stick with that therapist, with that clinician, so the continuity of care. And we believe in hands-on service. So that has been the reason for our success so far.
Well, we know the location here. I've mentioned in Tinley Park. Tell me a little about Tinley Park.
Tinley Park, that location, we opened that as a satellite facility of this location. But we've been there 15 years at the 179th and LaGrange. We provide mainly physical therapy there. We don't provide speech pathology services there. That location is also open Monday through Friday. And patient population-wise, it's the same demographics for patients.
Okay. You're located right on Route 83, near Ridgeland Avenue. There's parking in front, there's parking in back.
Absolutely.
So there's no reason not to visit, is there?
No, there's no reason not to visit. We handicapped accessible, and very friendly atmosphere. We listen to your needs and try to provide the best service we can, and that has been our story. So.
And I can back that up personally. I was going to ask you something else. I guess we covered it, but there was something else I was going to ask you. Well, anyway, But anyway, thank you for inviting us in. It's
Well,
always a pleasure to come and talk with you. Even I'm not scheduled to come.
Yeah.
I have to stop in every now and then and say hello. If you have any questions, we're going to put all the information on the tape. But basically, he's located. Oh, that's what I wanted to say. Your website is outstanding.
Thank
That's
you.
what I wanted to mention. So the website is www.pro-rehabpt.org.
That is correct.
And it's well worth turning on. It's very, it tells staff background, it tells what they offered. It answers almost every question that we've answered here today. It's very, very well done.
Well, thank you. So we have been here and again received well with our community, and we strive for our excellence in care, and we communicate with the physicians on a regular basis, and we participate in just about all major insurance companies. We are a participating provider for workers' comp companies, Medicare certified. We have, we've been in this location and by the community for 20 years. Hard to believe we've been here for 20 years.
Obviously, you're doing something right.
Well,
okay. Basically, it's Pro-Rehab Services, 6400 College Drive. The number is 708-489-6777. Don't hesitate to call them if you need them. Jacob, thank you for talking with us on Channel 4. We look forward to seeing you next time.
Well, thank you.
And of course, thank you for watching us here at Palos Heights Channel 4.